The world's worst ever outbreak of the deadly Ebola virus shows no sign of slowing down. For months here, they've been fighting it. Now Sierra Leone is the latest country to declare a state of emergency. Out of around 1,300 cases in West Africa, 729 people have died, 57 of those in just a 4-day period. Here in Britain, there have been no cases yet, but it's claimed airport staff are unprepared if anyone does arrive with symptoms.
Staff are worried and they need to be reassured if they could get more detail on exactly what it is that they're supposed to be looking for, more localised contingency plans. If someone arrives at Manchester particularly, where are they supposed to go in the meantime? If they arrive at Heathrow, what do they do there? And so on and so forth.
This is the front line of our defence. A highly secure isolation unit at the Royal Free Hospital in London on permanent standby in case the virus spreads here. Even the air in this room is sucked out and filtered to get rid of any airborne viruses. The patient has to stay inside this tent and medical staff can only treat them using these special suits. So there's never any direct contact that could cause contamination. There's never been a case of Ebola in the UK, and the last time they treated anyone for a highly contagious virus here was 2 years ago.
It is actually very intimidating because you're never alone. You always have 2 nurses with you at all times. You've probably got a doctor with you most of the time, especially if you're sick. You only have a very small space, but if somebody is a bit more well, then they're actually able to stand up, as we can actually bring the isolator out, but they still don't have very much room for movement.
There's no vaccine or cure for Ebola, so the only thing they could do here is quarantine the patient and provide intensive rehydration. But there are only 2 beds, so a bigger outbreak, although unlikely, would require further contingency plans. Rebecca Barry, 5 News.